We're pleased today to be speaking with Dr. Judith Trudel, who's a clinical professor of surgery at the University of Minnesota and a practicing colorectal surgeon in Minneapolis, Minnesota. Good morning, Judith.
Good morning.
Could you tell us what got you interested in colorectal surgery?
So I knew when I was a teenager I wanted to be a surgeon. And the path, I wanted to be a neurosurgeon actually to start with. And the path to get there was to become a general surgeon. I ended up at McGill University as a general surgery resident. And the training wheels operations in those days were the appendectomies and the cholecystectomies. That was the GI surgery. I really loved this kind of surgery. And as time went on, I got interested in the more major surgeries that became the colectomies. As a fourth-year resident, I was fortunate enough to rotate on Phil Gordon's service at the Jewish General Hospital in Montreal for 3 months. And that was love at first sight with the specialty when I really started doing it. Phil was a wonderful surgeon, a wonderful teacher, a wonderful mentor, and I was like a little puppy dog and I followed him everywhere. I went with him for ORs, I went to clinic, everywhere. He was just constantly teaching, and it really gave me the bug for colon and rectal surgery. And after that, it became, it was just a fait accompli that what I was going to do was to be a colon and rectal surgeon.
So obviously Phil was one of your early mentors.
Correct.
Who else had an impact on your career?
So, I mean, at McGill University, there was very few people who were colon and rectal surgeons at that time. Phil Gordon was one of them. Paul Beliveau was another, who also trained at the University of Minnesota, was another one of the colon and rectal surgeons. And that was about the sum total of the trained colon and rectal surgeons. So both of them were clearly instrumental while I was in Montreal. Then I was lucky enough to match at the Cleveland Clinic Foundation in Cleveland, Ohio. And at the time when Vic Fazio was the chair of the department, Ian Lavery was there, David Jagelman was there, and Frank Weekly. There's just only 4 surgeons at that time. Vic was a wonderful mentor through my time as a resident in colon rectal surgery, and then through my career, opened so many doors for me to be a member of the society, to participate, to be a board member. My mentors really opened a ton of doors for me. Ian Lavery was a mentor in a different way, in a very, I'm looking for the right word. Ian is not a very flamboyant person, but he is just the salt of the earth and a very sound person to be able to bounce ideas off. So again, through my career, Ian has been a wonderful counselor. David Jagelman, unfortunately, as you know, died pretty prematurely, so I didn't have much time to have a long relationship with him.
Judith, you've had a strong interest in education. Can you describe how your career progressed from the educational standpoint?
It's something I've always been interested in, so I think it probably goes back to my family roots. My mother was a great school teacher and imparted to all 4 of us, I've got 3 siblings, all 4 of us, how important it is to teach the next generation. So it starts basically when you're a resident and you start teaching your underlings. And I always derived a lot of joy out of education and helping the next generation. And I realized this is very much a paid forward type of thing, that as surgeons we are indebted to the people who teach us and allow us to learn on their patients. We're also indebted to the patients for letting us do it. And the way to pay it forward is to teach the next generation. So it's also part of our Hippocratic oath that we will teach the next generation, just the way our forefathers taught us. So that was, a big part of this. I went back to an academic institution once I was finished with my colon and rectal surgery residency in Cleveland. I was at McGill University for 14 years. I became the program director when I was there of general surgery. Again, having an impact and being able to shepherd the career of a number of young residents was very gratifying an experience. And then when I moved to Minnesota, now 15 years ago, with colon rectal surgery associates in the Department of Surgery, after a few years when Ann Lowry became president of the society, I became acting program director as she was busy as a president, and that when she stepped down from that position, I assumed the position of program director, which I've now relinquished a year ago. So I've basically been involved with education through my entire career.
You've had a very long, distinguished career in this specialty. What contribution are you most proud of?
So I would say the society is a very special society in the sense, you will hear me say, and I probably all the time, this is the only place where no good deed goes unpunished. When the society is asking you to provide a service or to be involved, if you say yes, you will be asked to do some more. And I think I can't really speak of what is my most important achievement, but the will to serve whenever I was asked, the will to step forward and say, yeah, I want to be part of this society, I want to be contributing, I think that is probably by itself the most important thing.
So can you expand on how you got involved in the society and how your participation progressed throughout your career?
It's a very friendly collegial society, as you know. I first came to my first meeting when I was a surgery resident, so I was a chief resident at that time. The only person I really knew at that time was Phil Gordon, and Phil introduced me to a number of people, including Stan Goldberg, who just very first time, I'd never met the man, just knew the name, obviously, say, hey, my name is Stan. So first name basis with a young resident whom he didn't know at all, and I thought it was quite impressive. And then Stan said, are you a member of the society? Which I was not at that time. He said, I'm just going to sign your application paper. So he actually took an application form and made me fill it on the spot, and he signed it for me. He said, I'll take care of that for you. So that's how I became a member of the society. Stan Goldberg basically took me by the hand and got things started. And then, as you know, what happens is you become involved a little bit more, a little bit more, a little bit more, and it just snowballs into being very active in the society.
So what challenges do you see for the society in the future?
I think the biggest challenge is that the specialty, like many other surgical specialties, runs the risk of being morselated. We are seeing non-surgeons performing surgical procedures, and it's not necessarily a turf battle. I wouldn't put it in terms of turf battle, but I think we have a very unique expertise as colon and rectal surgeons, that people who can perform procedures that either are similar or in the same family don't necessarily have the expertise to deal with everything else that happens, all the complications, or an understanding of the disease process. We're not only technicians, we're also physicians in what we do. And I think preserving this very important niche for members of the society is important.
What about the society itself? What challenges do you see for it?
The society itself, I think, globally will need to move on. I mean, we are doing that, but move on to take even a bigger role internationally. I think that there is, if you look at what's happened between when I was a resident, where basically being a colon and rectal surgeon was virtually anathema in so many academic centers. You went to train in colon and rectal surgery, but when you came back to your institution, you were supposed to be a general surgeon with an interest in colon and rectal surgery. And we've moved from this to the realization that there is a real need for the specialty. And I think that realization worldwide also is something that the society needs to be involved in. We're seeing so much progress in the 30 years that I've been a member of the society, but there's still progress to be made.
Having experience with the Canadian system and the American system, what do you think, what's going to happen with us in the future?
Do you want to talk politics?
Sure.
I do not know what will happen in the future. I will say, having worked in both systems, that there is no such thing as a perfect system. I see advantages and I see drawbacks to both systems. I profoundly believe that it is unethical for a country as rich as the United States not to have some sort of universal coverage that is not dependent on your financial means. That for me that's a given. This being said, to be in a system where the coverage in theory exists, but in practice there are access problems because there's limitations in the finances, there has to be a hybrid system somewhere that allows us to cover both grounds. But you should not go wanting, you should not become broke, you should not have to choose between eating or receiving medical care. I profoundly believe that's unethical.
Anything else you'd like to say to the members?
Get involved in a society. This is a wonderful way to pay back, but also to nurture a number of friendships that will last you for life. It's a very special society because it will actually give back to you just the way, as much as you put in. So that's a way to do it, contrary to many other societies.
Thank you very much.
You're welcome. Thank you.